Good morning. I'm here with Abdul Ghaffar. He is the Executive Director of the Alliance for Health Policy and Systems Research, which is one of the co-sponsors of the symposium. Thank you so much for joining me today.
Pleasure, madam.
So we're going to talk about participatory leadership. Can you tell me why leadership has become such an important issue in the area of health?
Leadership has been always an important area because whatever happens, leaders play an important role in leading the organization, in directing the organization, in managing the resources, keeping the staff motivated. However, the recent crisis of Ebola and Zika has really enforced the health system community that if you really want to move forward, that has been a failure of leadership to a certain extent. Historically, when you look, people generally look like the leaders as a hero, somebody has done it, it's a role model and do that thing. But because of the complexity of the health system, it's not one person who can deliver. It could be a minister, it could be a district health officer, it could be a director of a program, it could be like a director of general health. Everybody has a responsibility, and if they don't work together, things are not going to happen. So what we are saying is the leadership in health, because of the complexity, is distributed, but it's connected, and everybody at every level has a responsibility, and if they don't do it, we are not going to succeed it.
What do you hope that the Alliance takes away from this report in particular?
I think what we very much hope is that this report, it is an advocacy piece, that it makes a case that the time has gone where we have to look for the heroes. Like there's one person that we need to have a competent, bright Secretary of Health. We need to have somebody who is the brightest Surgeon General. That's important. But everybody, like if you look at the integrated healthcare, where community, if one person is sick, it is the spouse, it's the children, it's the parents, the whole family has a role. Doctors do have a role, nurses do have a role. But the civil society has a role, pharmaceutical industry has a role, governments has a role, regulators has a role, and that is the role which everybody, if they don't play it, it won't work. So the purpose is that this triggered some sort of dialogue, and then we developed some sort of framework that if we really want to do the participatory leadership, right now it's at a philosophical level, that this is a concept, this is a philosophy, this is an approach, and it has happened. How it has happened, somebody has to really have a like sort of a conceptual framework or a model, so that if people wants to teach this, if the people wants to do it, they have a relatively, this is the first step, this is the second step, or this is the approach, they have to do it. And that is the purpose, and that's what we are going to do in the next 2 to 3 years.
I did want to ask you one question about resilient and responsive health systems, which is kind of the main focus of this conference. What lessons do you think can be learned from health systems research when applying to these resilient and responsive health systems?
See, when you say resilient system or it is a responsive health system, it means that the system is able to respond and take care of the people, population and the patient, not only in emergency situation, but also in the normal situation. Every day, there's this, like drugs are not available. Sometimes vaccinators are not available. Sometimes nurses are not available. So that is the system we want to have. The system is able to adapt, system is able to adjust, and system is able to learn from its own mistakes and positive things, and how it reacts and responds. And that's the resilience we want to promote it. So it's not only during the emergency or disaster situation, but it's also in day-to-day situation, and that is the resilience we want to have it. In that thing, if there's a science, research particularly, it's the health policy and system research, because this is transdisciplinary research, it's a multidisciplinary research, it's not one research like a biomedical research or a clinical research. It can use clinical research, it can use health economics, it can use social science research, it can use qualitative research methods, and it combines and brings all those sciences which can help to improve the systems and policies, and that is the science which is the most robust as health policy and system research. And this is the time, especially with the resilient health system, if we want to have it.
Well, great. Thank you so much for your time. I really appreciate it.
My pleasure. Thank you very much.
Thank you.
Thank you.